3 in 10 American girls will get pregnant at least once before age 20. That's nearly 750,000 teen pregnancies every year. Long-term reversible contraception should be offered to teenage girls over birth control pills. The United States has one of the highest teen pregnancy rates in the Western industrialized world. The chance of getting pregnant without birth control methods is 85 in 100. Condoms are only 98% effective if used perfectly every single time of intercourse. Oral contraceptive pills are 92 to 97% effective if taken every day at the same time. Long-acting reversible contraception, also known as LARC, are the most effective types of birth control for teens. The American Academy of Pediatrics recommends long-acting reversible contraceptives such as IUDs and the contraceptive implant as the best line of defense against teen pregnancy. Gynecologists have backed long-acting contraceptives for teens since 2012, as have various women's health groups saying that these methods are safe and more effective than any other form of birth control. LARC is safe to use. Does not require taking a pill each day or doing something each time before intercourse. LARC can prevent pregnancy for 3 to 10 years depending on which method is chosen. Less than 1% of LARC users would become pregnant during the first year of use. Long-acting reversible contraception options available are the Nexplanon, which is a tiny rod that is placed into the arm by a healthcare provider. Nexplanon is 99.9% effective against pregnancy and lasts up to 3 years. Nexplanon can be inserted during an office visit. An IUD is a tiny device that's put into the uterus to prevent pregnancy. IUDs come with hormone or without hormone. IUD with hormones can be used up to 3 to 5 years depending on which IUD is chosen, and are 99.9% effective. These IUDs may reduce cramping and heavy cycles. Some females will see cycles stop entirely with the hormone IUD. Non-hormonal copper IUD, also known as the Paragard, lasts up to 10 years but has no bleeding profile. IUDs currently available in the United States are the Paragard, which is approved for 10 years, but the FDA is trying to get it approved for 12. Mirena, which is good for 5, but the FDA is trying to get it approved for 7 and has been done in Europe for 7 years without any problems. Liletta, Kylena, and Skyla are other options, and they are good for 5 years as well. Paragard is the only non-hormonal IUD available and is 99.2% effective. Paragard is effective for 10 years. The Depo-Provera shot is a convenient injection that is given 4 times per year. 1 injection prevents pregnancy for 11 to 13 weeks. Depo-Provera is also a good option used for cycle control. However, this percentage increases when a woman doesn't receive the shot at the recommended time. So anytime before 11 weeks or anytime before 13 weeks, it's recommended to get the injection. Teen pregnancy can carry health and economic and social costs for mothers and their children. We need to encourage teens not to have sex, but recognize LARC as a safe and effective choice of birth control for teens. End.